My name is Karen Holmes. I'm the Centre Manager at the Cancer Support Centre in Sheffield. Here today to talk about holistic care and living with and beyond cancer, which is sometimes called survivorship. There are many healthcare problems that we encounter. We have an ageing population, which just increases. People have far more comorbidities. We have improved research and treatments for cancer. And we know that we are following up people for a long time, and we know we've got an increase in cancer. Could be 1 in 3 of us get cancer in a lifetime. Recently, in July 2015, the new cancer strategy for England came out for the next 5 years. This is following the 5-year forward view, which has 96 recommendations. I'm certainly not going to go through the 96 recommendations, but overall, it's about improving prevention, survival, experience, quality of life, and making sure that we have an efficient and effective service of delivery. When we start to look at survivorship, we have a framework that we start to think about. This is ensuring that we have information and support from the point of diagnosis. We certainly need to look at promoting recovery. There needs to be an area where we start to sustain that recovery, and we need to look at managing consequences of treatment and late effects of treatment, and we need to be supporting people in active and advanced disease. This came in March 2013. From the new cancer strategy in July 2015, it talks about a recovery package. This is something that the cancer world has been looking at probably on and off for the last 5 years. The recovery package is looking at supporting people to self-manage the disease. We're all going to be living longer, we're all going to be surviving cancer, and we need to learn to live with it. A lot of what's in the recovery package is transferable to other long-term conditions. You can see from the recovery package the triangle. There's an area of assessment and care planning, part for health and wellbeing event, and something about treatment summary and a cancer care review. It's about physical activity and lifestyles that we need to change to ensure that we continue living life to the full. So if we look at the holistic needs assessment, in January 2007, the Holistic Common Assessment of Supportive and Palliative Care Needs for Adults with Cancer was a big documentation that started to look at the different tools that we can use to do holistic needs assessment. There are 5 domains that we need to look at whenever we're looking at holistic needs. Part of that is the information needs of patients, physical needs, the social and occupational needs, the psychological well-being, and the spiritual well-being. Those 5 areas need to be considered when we're doing the assessment. So when we start to look at actually drawing and assessing a care plan, we need to look at the effects of the symptoms on these particular needs. So the physical, the social and occupational, psychological and spiritual. What is happening? How does that patient cope? What are the problems that they're still having for us to kind of really do a good assessment? Some of the assessment tools that are in the documentation from 2007 are the distress thermometer, a spark tool, which I will explain, and a concerns list. In total, I think there was about 20 different tools that you could choose from. And so you really need to kind of have a look and see what fits in your own area. Some are quite easily transferable into other areas, and some are very specific to cancer. But again, search them through and have a look. The Spark tool is the Sheffield profile for assessment and referral for care. This is a questionnaire which has 45 questions. And when you see the form, it is quite long, but it's not you, the healthcare professional, that's completing it. It is the patient. And on the form, I'll give you an example on the next slide. It asks the patient to kind of look at how much it's been a distress or it's bothering them on a score of 0 to 3. So this is an example of the psychological issues. So you can see on the score from 0 to 3, 0 being not at all, to 3 being very much. Once the patient has completed the full tool and answered all the questions, as a healthcare professional, you can flick through it. Now, you might get the patient sitting at not at all, circling all the zeros. That's fantastic. They haven't got any issues at all. You might have some that have a 1 or a 2 or some of the 3s. It's really kind of the 2s and the 3s we need to be looking at and kind of going in a little bit more depth and just asking around what their issue is. So if they are feeling anxious and they've circled 3, we might ask a few more kind of pertinent questions to actually, how does it make them feel? What's happening when they feel anxious? To really kind of find out what's underlying. Is it family issues? Is it a condition from the treatment that they're having, a side effect? We really need to kind of unpick why they're feeling anxious and how does it make them feel. This is part of the distress thermometer and mixing in a bit of the concerns list. So again, on the right-hand side, you can see the practical problems, family problems, emotional problems, spiritual concerns, and physical problems. This can be used in 2 different ways. You can use it as the healthcare professional asking the patient kind of if they have any of these issues and ticking them off, or you can hand it to the patient for them to kind of read through and tick for themselves. Again, then handing it back to the healthcare professional so we can start to unpick some of the issues. The thermometer on the left-hand side is exactly as it says. So if they've got no distress, they might be circling 0 up to 10, which would be high distress. So you can kind of monitor how they are feeling depending on where they're scoring themselves. This is just distress thermometer in colour so you can see. And again, some people will use the Spark tool and just throw in the distress thermometer as the thermometer right at the end just to get an overall view of how that patient is coping. Along with most of these tools, there is a chance for patients to have kind of 3 main concerns, free text box that they can write in to express their concerns. This helps when you start your consultation with a patient because we don't want to start with the medical bit and the things that we need to be checking out. We really want to start the conversation off with the patient. What are their main concerns? What are they really worrying about? And we can start the consultation with that. So when we've done using the tool, we then need to start to look at the action plan. So we've been listening, we're responding to the concerns they've got, but we need to consider why that is an issue. What can we do to change that issue? Who's going to do it? When are they going to do it? And how is it going to be done? These are the questions you perhaps need to be asking when you're trying to formulate the action plan. Now we'll move on to the health and well-being educational courses. This is a course for patients in a group setting to learn more about how to cope with things and how to self-manage. In Sheffield, we have a Living with Cancer course called Positive About Life, which is run at the Cancer Support Centre. Nationally, we have Macmillan doing a Hope course, that's helping overcome problems effectively. And the Maggie's centres, which are up and down the country now, are doing a course called Where Now. These are all generic, so it's not a specific cancer, it's all cancers mixing together and going through different topics. There are some site-specific courses around. Breast cancer care do moving forward, and in Sheffield again at the Cancer Support Centre, we've developed the Positive About Life course, but very specific on prostate. So that gives us a chance to look at things in more detail, like hot flushes, PSA levels, erectile dysfunction, in a safe setting where they can discuss and feel quite comfortable. Just to explain a little bit about the Positive About Life course, and what topics we discuss on the 6-week programme. They are all similar with the Hope course and the Where Now at the Maggie's Centre, but just in a bit more detail. So we cover stress and anxiety. We look at the signs and the symptoms. We look at why does the body react that way and how can you manage those reactions better. We look at putting some coping strategies in to manage those. We look at fatigue, which is a big one when people are on treatments. Why do they have that fatigue and how can they manage that fatigue better? It's all about planning and pacing and putting a timetable together, looking at short-term goal setting, which we can help them do in the 6 weeks. There's a section on communication. This is with healthcare professionals and with families. So how do they get across the questions that they have for healthcare professionals? And more importantly, how can they remember what's said back to them? With families, it's about how to communicate well, but it's also about how to close the conversation down about cancer or their illness. A lot of families and patients particularly struggle with that certain members or friends are just constantly asking them how they are, and they don't want that. We're looking at lifestyle, healthy eating and exercise. Again, there's still a lot of misconceptions out there about what is healthy eating. What do you need to consider to be eating if you've got a low appetite? So we spend some time looking at that. Exercise. We know that exercise can help with fatigue, but it's very difficult if you are fatigued to have the motivation to go and do some form of exercise. So again, just encouraging them from very basics, maybe just walking down to the bottom of the garden daily and building up to walk around the block, to actually kind of doing some sort of exercise or healthy walking in their local area. Sleep and relaxation. Again, this is from the practical outset of how old is the mattress? How old are your pillows? Are they still comfortable? Right the way through to the middle of the night when somebody might wake up and be in a really dark place. How can they manage that? How can they pull themselves back out of there? Complementary therapies, we look at the different names. So what's shiatsu? What's reflexology? What's Reiki? Explaining about these therapies and the benefits of receiving these therapies. And holiday planning isn't just about kind of travel insurance. It's about caring for yourself whilst you are away, reducing the risk of infection or becoming unwell whilst you're on holiday. All the things that we as healthy people probably just take for granted. People that have got an illness or following cancer treatment need to take good care of themselves. The comments from the Positive About Life course have been very positive. One client here is saying to have stress and anxiety recognised is amazing. You can't underestimate how much stress and anxiety people do carry. Helped me to be more confident, more upbeat and trying to be positive and to stop worrying. Just sharing in the group with people like-minded that have gone through similar issues is great, and the support that they give each other is really good to see. The way that we evaluate the Positive About Life course is we use what we call an outcome star. This is a tool that at the beginning of the course, we will give the patient a blank star and ask them to plot themselves on that star. At the end of each prong, you'll be able to see a topic, so your lifestyle, looking after yourself, managing symptoms, where you live, friends and family, and feeling positive. We give the client a paper which describes each of those areas, and they plot themselves from 1 to 5, 1 being that they're at the worst point and 5 that they're actually managing really well. So you can see from this slide, the blue line is the pre-course scoring. And then after the course, once they've completed, we give them another blank star with their descriptions again, which they can go through and plot themselves. So from here, we can see that people have actually moved forward and attending the course has made a difference. They're managing to self-manage much better. From the recovery package in the triangle, we had health and well-being. We've just talked about education, courses, Now I want to talk about events. This could be when you get all the different services that might be useful for people to consider, might need them now or they might need them in the future. It's very much about building up the memory bank of what is available should I need support in the future. On this slide is just some different services that we've pulled together. So some you will see are very specific to site-specific cancers. And that's the way that we have moved with health and wellbeing events. We have done prostate days, we have done breast cancer days, and we have done colorectal bowel cancer days. So services that are relevant to those areas we've pulled together. Other names that you will be familiar or you might hear to say that the wellbeing event is the roadshow, open days, showcase, big clinic, or a market stall. And actually having all these services in one area is really good, particularly if you look at the prostate days, where we've had the erectile dysfunction service there, we've had the gadgets around. It's meant that the men, their wives, their friends can actually pick it up, play with it. It's not such a taboo subject. There's been a bit of a giggle around, but actually it means that should they struggle in the future, they know there is a service that can help them. Likewise, having the continence service around or the lymphedema service, again knowing that they don't have to struggle with these conditions that they might come up against. There is something that can help them. The patient evaluations from having these open days has been great. 98% said that they had learnt about new services, and 100% said they felt it was a worthwhile event. You can't underestimate the stallholders' evaluations. Actually, other healthcare professionals really understanding the different services that are available and learning how you can refer to them, or actually what it would mean if a patient was referred, is being really good. So, what do you need to consider? Looking at holistic care, looking at survivorship. You really need to ensure that you listen. Don't guess what the patient is struggling with. We need to assess them properly. One other thing we really need to start to work towards is stop making patients patients, make them become people. People are living longer. They need to be away from secondary care and back into the community, which is where they live. We need kind of primary care to be supporting these people, and we need to move with this. Find out what is available in your area. What services could you access? Ensure that you've got some practical advice that you can give to people when you've got issues that come up and concerns that are raised. And start to think outside the box. If you work for the NHS, I think we always try to find solution within the NHS. We need to come outside that box and see what's happening. Within Sheffield, we have Activity Sheffield, which is working with the local gyms to refer people to be assessed, to look at an exercise programme. That's not about getting everybody back to the gym. That might be joining the healthy walks in the localities. So we're not kind of just sending people in a group that is cancer orientated, but we will be looking at other healthcare issues, so cardiac issues and other things that people are struggling with but are needing to exercise again. So really start to search out what else is in your localities. And look out for who else you can work with. There are charities out there, the voluntary sector, that are willing to consider developing things, work in tandem. It's about co-production here and moving forward. So don't forget, this is what you need to consider to take forward. So back to the triangle, the recovery package. Again, this is about looking at information. People have real big information needs, and sometimes we don't kind of complete those. We don't give them the information that they require. Make sure that you know how to signpost to other services. Look at different self-management courses that are out there. Consider health and wellbeing days. Pull in all the different services together. and ensuring that you can signpost people to a helpline maybe, where all these different services can be under one roof. Thank you for listening.